Welcome to Knowledge Park. Today we explore thyroid health. Have you ever felt a profound, bone-deep exhaustion that no amount of sleep can fix? Or notice the numbers on the scale creeping up despite your best efforts with diet and exercise? Perhaps you've seen more hair in your brush than usual, or struggled with a mental fog that makes it hard to concentrate. For millions of people, particularly women, these aren't just isolated bad days. They are persistent, frustrating symptoms that point to a common, yet often overlooked culprit. The source of this daily struggle frequently lies hidden within a small, butterfly-shaped gland in your neck, the thyroid. And very often, the root cause is an autoimmune condition known as Hashimoto's disease. Understanding this connection is the first step toward reclaiming your energy, your focus, and your overall well-being. Let's delve into the vital role your thyroid plays and what happens when its delicate balance is disrupted. Nestled at the base of your neck, just below the Adam's apple, is the thyroid gland. Though it weighs less than an ounce, this small organ is a powerhouse, acting as the master regulator of your body's metabolism. Think of it as the engine room of a sophisticated machine. Your body, it produces two primary hormones, thyroxine, also known as T4, and triiodothyronine, or T3. These hormones are secreted into your bloodstream and travel to every single cell, from your brain to your toes. Their job is to tell your cells how much energy to use and how quickly to use it. T4 is the primary hormone produced, but it's largely a storage hormone. The real workhorse is T3, which is far more potent. Most of the T3 your body uses is converted from T4 in other organs, like the liver and kidneys. This intricate system ensures that every part of your body gets the precise amount of energy it needs to function optimally. The influence of these thyroid hormones is vast and touches nearly every aspect of your health. They are the conductors of your metabolic orchestra. They dictate your basal metabolic rate, the speed at which you burn calories while at rest. This is why the thyroid is so closely linked to weight management. They also act as your body's internal thermostat, regulating your temperature. If you're constantly feeling cold when others are comfortable, your thyroid might be underperforming. Your brain function is also heavily dependent on these hormones. They are crucial for concentration, memory, and mood. A well-functioning thyroid supports mental clarity and emotional stability, but their reach doesn't stop there. Thyroid hormones help maintain a steady heart rate and healthy blood pressure. They regulate the pace of your digestive system, ensuring nutrients are absorbed efficiently. They even control the rate at which your skin, hair, and nails grow and regenerate. When your thyroid is working correctly, all these systems run smoothly in the background, a testament to its quiet efficiency. It's a delicate balance, a symphony of cellular communication that keeps your entire body in harmony. But what happens when this conductor falters and the music begins to slow down? When the thyroid gland fails to produce enough hormones, the entire body slows down. This condition is known as hypothyroidism, or an underactive thyroid. The engine room is no longer supplying enough power. Your metabolism decelerates, leading to unexplained weight gain and difficulty losing weight. Your internal thermostat is turned down, causing a persistent feeling of coldness. Brain fog descends, making it difficult to think clearly or remember things. You feel tired all the time, a deep fatigue that sleep doesn't resolve. Your heart rate may slow, your digestion becomes sluggish, leading to constipation, and your skin can become dry, your hair brittle, and your nails weak. This systemic slowdown is the body's response to a critical energy shortage. The command center in your brain, the pituitary gland, senses the low hormone levels and shouts louder by releasing more thyroid-stimulating hormone, or TSH, in an attempt to get the thyroid to work harder. But if the thyroid is damaged or unable to respond, the shouting is in vain. and the symptoms of hypothyroidism persist and often worsen over time. Common hypothyroid and Hashimoto's symptoms include profound fatigue, unexplained weight gain or difficulty losing, feeling unusually cold, brain fog and poor concentration, low mood or depression, slowed heart rate, dry skin, brittle hair, hair loss and weak nails, constipation and sluggish digestion, puffy face or water retention, heavy or irregular periods, muscle aches and joint stiffness. If these sound familiar, ask your doctor about testing for hypothyroidism and Hashimoto's. So, what causes the thyroid to fail? In the vast majority of cases in the developed world, the culprit is an autoimmune disease called Hashimoto's thyroiditis. In a healthy immune system, your body's defenders, like T cells and B cells, are trained to attack foreign invaders like viruses and bacteria. In an autoimmune condition like Hashimoto's, this system gets confused. It misidentifies your own healthy thyroid tissue as a threat. This is a case of friendly fire. The immune system creates specific antibodies, most notably thyroid peroxidase antibodies, or TPO antibodies, which target and attack the thyroid gland. This leads to chronic inflammation and a gradual destruction of the thyroid tissue. Over months and years, this relentless assault damages the gland to the point where it can no longer produce the hormones your body needs. The result is the onset of hypothyroidism. While the exact cause of this immune system malfunction isn't fully understood, it's believed to be a combination of genetic predisposition and environmental triggers. Things like chronic stress, infections, or even certain nutrient deficiencies can potentially activate the disease in someone who is genetically susceptible. It's also overwhelmingly more common in women, who are 5 to 8 times more likely to develop Hashimoto's than men, suggesting a hormonal link. If these symptoms sound familiar, getting a proper evaluation is essential. It begins with simple blood tests. Your clinician will usually review a few markers: thyroid stimulating hormone, or TSH, free T4, and, when appropriate, thyroid antibodies such as TPO. These results are interpreted in context, your history, exam, and other factors. Next steps are individualized. Discuss the findings and your options with a qualified clinician. This video is educational and does not give medical advice. Quick reference: ranges vary by lab. TSH about 0.4 to 4.0 milli-international units per liter. Free T4 roughly 0.8 to 1.8 nanograms per deciliter. Free T3 around 2.3 to 4.2 picograms per milliliter. TPO antibodies, negative or as low as your lab defines. Pregnancy and special contexts use different targets. Follow your clinician. When a care plan is made, consistency and follow-through matter. Work with your clinician to choose an approach that suits your routine, preferences, and goals. Ask about monitoring, lifestyle support, and follow-up timing. If questions or side effects arise, contact your healthcare professional promptly. With a clear plan and regular check-ins, many people experience meaningful improvements in energy and day-to-day life. Part 4. Lifestyle and diet support. Lifestyle choices significantly reduce inflammation and improve symptoms. Focus foods. Selenium protects thyroid. 2 Brazil nuts daily, plus eggs. Zinc activates hormones. Pumpkin seeds and lentils. Iodine with caution. Use iodized salt. Avoid high-dose supplements. Anti-inflammatory plate. Fatty fish, olive oil, and colorful fruits and vegetables. Manage goitrogens like broccoli and cabbage. Enjoy cooked soy in fermented forms, spaced from medication. Consider a trial gluten-free approach. Avoid ultra-processed foods and added sugars. Now, a very important question that affects many of you. If I live in a coastal area, do I still need iodized salt? This is a crucial detail for managing Hashimoto's. The answer is, you likely need to be more cautious. Here's why. The air, soil, and water in coastal regions are naturally rich in iodine. More importantly, your regular diet is likely already high in iodine from local foods. Local foods like fish, prawns, and other seafood, and vegetables grown in iodine-rich soil can raise daily intake. Because of this, your iodine may already be sufficient, or even too high for someone with Hashimoto's. Remember, in Hashimoto's, the thyroid is already inflamed and under immune attack. Adding excess iodine can sometimes act as a trigger, worsening the autoimmune response and increasing antibody levels. So, what should you do? Practical takeaway for coastal residents. You do not need to actively avoid seafood. It's a healthy part of your diet. However, for daily cooking, it's a good idea to switch from iodized table salt to a non-iodized salt. Excellent choices include Himalayan pink salt, Pakistani rock salt, or Senda Namak. Double-check the label for non-iodized. If you simply want a natural, unprocessed salt without additives, any of these will work. Himalayan pink salt, any unrefined sea salt labeled 100% natural with no anti-caking agents. Celtic sea salt, or flake salt like Malden. This simple change can help calm the autoimmune response and support your thyroid management strategy. Part 5. Movement, breath, and latest research. Choose low-impact cardio like walking, swimming, or cycling. Add strength training to boost metabolism. Manage stress daily. Practice Nadi Shodhana or Brahmari breathing. Avoid neck-straining poses like Sarvangasana if uncomfortable. Latest research highlights the gut-thyroid axis, support with probiotics and fiber, low vitamin D links with higher antibodies, and personalized medicine exploring combined T4 plus T3 therapy for select patients. Advanced insights. Lab targets can be individualized, especially during pregnancy or special circumstances. Some markers are most useful in specific contexts. If symptoms persist despite well-interpreted labs, specialists may consider other explanations and tailored strategies. Important testing note: certain supplements or lab interferences can skew results. Share what you take and confirm any test preparation with your clinician or lab. Whatever plan you and your clinician agree on, keep it consistent and communicate regularly. Additional evaluations, like ultrasound for nodules or follow-up for postpartum changes, may be considered based on your situation. Partner with an endocrinology professional for personalized care. Advanced management overview. When progress is slower than expected, clinicians may look for contributing factors, such as digestive conditions, interacting products, or unrelated health issues. Your care team can adjust the overall approach, recommend supportive nutrition and lifestyle changes, or refer for additional evaluations when appropriate. Imaging and fine needle aspiration are considered only when features appear concerning. For less common conditions like central hypothyroidism, monitoring focuses on the markers your clinician advises. All decisions are personalized. Use this video for education and rely on your clinician for medical guidance. Conclusion and action plan. Get tested. TSH, free T4, and thyroid antibodies. If treatment is prescribed, take it correctly and consistently as directed. Eat smart. Selenium and zinc sources. Emphasize anti-inflammatory foods. Cook goitrogens. Consider gluten reduction. Move gently and practice daily stress relief breathing. Partner with your doctor to take back control. Thanks for watching. Please like, share, and subscribe.